The Special Olympics Idaho Summer Games brought athletes from across the Gem State to Nampa last May. But one of the biggest storylines from those games happened away from the competition, where a program built around care is trying to close a healthcare gap many people never see. On a track, in a gym, or in a pool, there is no question what Special Olympics athletes are. They are athletes. The question is, what happens when the uniform comes off and the care they need is much harder to find?
The doctors just kind of push us to the side and give us only a little bit of time when we could have like an hour for a checkup, and then we just, if we are really sick, we just get pushed to the emergency room.
Alexis has lived that gap. Now, as a health ambassador, she works alongside Lexi Ahrens, who saw it through Special Olympics Idaho. Lexi's background is in psychology and sports psychology, and she saw how closely health and athletes are connected. In Idaho, part of that work started with growing healthy athletes.
Practice press, breathing through your nose. There you go. And then open real nice and big.
Healthy Athletes is a Special Olympics North America program. So other states have been doing it for a while now. But in Idaho, we weren't doing it for a long time. I think we did some screenings here and there, but we didn't really do it at the scale that we do now.
That scale has changed. Healthy Athletes now fills a gym at Summer Games, but the reason it has to exist is much harder to accept. These are athletes who train, compete, and represent their communities, and still, too many of them run into a healthcare system not built to meet their needs.
Medicaid is a monster in itself, and for example, a lot of our athletes can only go into the doctor once a year. So if anything comes up throughout that portion of the year, then they have to go to the emergency room.
And getting in and being seen is only part of the barrier.
Communication, using things in plain language, providers not being trained to work with people with IDD, and so sometimes someone with IDD comes in the doctor and maybe they just kind of write off what they're saying because they're not sure maybe what they're saying. Maybe they don't give them enough time and to express what they're feeling.
At the Summer Games, Healthy Athletes becomes a starting point, a way to catch what has been missed and point athletes towards care. But for Lexi, that is only the beginning. The longer-term fix is the next appointment and the next provider an athlete comes across.
But a lot of these programs don't actually train providers on how to work with somebody with IDD. A person coming in with IDD is different than somebody else when it comes to expressing themselves or, reading medical forms. That's one of the things we do. We're going in there trying to train these schools on how to best serve people with IDD because it's just not in curriculum.
That is what Lexi is trying to change in Idaho. Not just access to care, but the way athletes are seen, heard, and treated when they need it.
People with IDD still need the same help as everybody else in the community, even though we have a disability. We need the same care as all the other humans in this world.
The same care as every other human in the world. Let that sink in. It should not be a high bar, but for too many athletes with intellectual disabilities, it unfortunately still is. That is the gap Lexi is trying to close, and the one Alexis refuses to let people miss.